For those of you who don't know me, I'm Bill Halpin, the CEO of the South Boston Community Health Center, and it's my pleasure to welcome all of you and our distinguished guests. I've been here for 25 years now, and I've seen a lot of change at the health center. But one thing that has never changed, and I know will never change, is the unwavering support that we receive from local officials and our elected representatives. It is actually quite remarkable, and I'm very blessed in that sense, and we all are very blessed. And I have the most wonderful staff who are standing in the background. Really helped us get through the pandemic, which we're all trying to forget about, but the picture of them over there, we just did remarkable work during the pandemic. And now we're on to our next remarkable achievement, which is going to be our expansion. We're going to build 2 additional floors on the health center, 11,000 square feet, and it's really going to enable us to serve our community more fully and really in a much more sort of customer-friendly kind of way. And the great thing that it's going to do is it's going to provide us with additional space so we can keep expanding our behavioral health program, which is growing in leaps and bounds, and it's just a real source of pride for us. I mentioned before that never have I doubted the unwavering support of our local officials. Standing tall in that regard is the gentleman to my immediate left, Congressman Stephen Lynch. I first met the congressman 25 years ago. We were in a little bit of trouble, no questions asked. My favorite Stephen Lynch story, actually, is I was asking him for special support out of a fund called the Essential Community Provider Fund. And I was new, I met him before. I'm kind of nervous, and I'm talking to him. I got slides and everything else, and he's kind of doing this. And I'm like, oh boy, this isn't going well. Finally, he interrupts me and he goes, Bill, how much do you need? I said, $500,000. He goes, I'll get you $750. I gotta go. And you know what? He got us $750, and away we go from here. So with that, I will, our expansion is a really wonderful sort of tribute to the public-private partnership. We're putting in some money, and everyone here has helped us secure earmark funding, and it's kind of the way good government should work, if you ask me. But, so anyway, without further ado, Congressman Stephen Lynch.
Good morning, everyone. Madam Mayor, I'm glad to see that you arrived safely. She was a little late because they got a new rule, no running red lights at all. But seriously, I'm glad you are well, and thank you for your partnership. You'll hear a lot about this morning. This has been really a team effort, right? As Bill mentioned, we've got great representation here locally from the state, the city, and there's not been a better partner to our community health centers than Mayor Wu. She has been a champion of this, not only as mayor, but also during her time as city councilor as well. She was, I think, keenly aware of the importance that health centers provide to our local communities, so we're blessed by her leadership. I do want to talk a little bit about this funding. So we've got $2 million that are being awarded today, which will cover the design, architectural drawings, and some of the construction, but we have more to do here. And so this won't be the last of the federal grants that come here to the South Boston Community Health Center. But the money is different. So typically the way money comes from Washington is it goes from, the president will sign off on a bill that is an appropriations bill. It goes to the local governor, the state governor, and then the governor decides what project will be funded. That's not how this works. So this is called the priority project funding, and it comes from the local level. So the people standing up here, including the mayor, City Council President Flynn, City Councilor Flaherty, Senator Collins, City Councilor Murphy, City Councilor Baker, State Representative Beal, and Senator Collins, they came to the federal government and said, the South Boston Community Health Center is doing really, really good work, and we need to help them expand. And here are the reasons why. And they laid it all out. They said, during the pandemic, this small, soon to be bigger, community health center provided 35,000 vaccines. They had a tent in the backyard because it's not big enough. People would drive through, and thank goodness we had the support of the city of Boston because we needed traffic management there. The Boston police came down and directed the cars through because we had the cars were backed up to L Street, everybody waiting to get their vaccines. This little health center did that. It was the first health center in the country that was recognized by the federal government as being a direct object of their vaccines. So in many cases, they were giving it to the governors, the vaccines. But in this case, South Boston Community Health Center was pushing out so much product and vaccinating and testing so many people that they gave it directly to the health center because they knew it would be deployed very quickly and it was an emergency. So that's to the credit of the people in the back there, the staff, and Bill, but a wonderful, wonderful, wonderful job.
So thankful for the 50 years plus of service to the community. I know we've been hoping to celebrate this for some time, so I'm finding the timing a little suspicious. Right after my incident, Michael keeps calling me, did you go to the doctor? Did you go I'm like, I feel fine, I'm okay, I'm a little stiff. So now the subliminal messaging of they're staging an intervention, so I'll get seen here afterwards or something like that. Don't worry, I'm okay. Thank you so much, though. You really are the connection point to so many in our community, and to serve the number of families with the care and personalization and knowing everything about their needs, their hopes, their dreams. That is what's special about the Community Health Center movement, one that was started right here in Boston. I know personally from my family's experience what a difference it makes when, for example, your mom can get mental health care in a space that is uniquely attuned with the language and cultural competency and just proximity to where you are and as you move through your life, what a difference that makes. And we're so grateful to Congressman Lynch and the delegation for securing this funding so that you all can continue to serve our residents even more with even more services and even more space to do that in a dignified and caring way. So we're so grateful. There's not just, you think about health centers and hospitals and you might think about doctors and nurses and the medical care, but the fact that the food pantry is such an important source of support and services, the relationships, expanding behavioral health, this is exactly what we need in this moment. So thank you again for your leadership, Congressman, and to all of the delegation here. Thank you to Bill and the team. We look forward to fighting for you all to have your resources and supports for another 50 plus years, and we're grateful to stand with you. Very proud and grateful to pass it on to our incredible partner on the City Council, your City Council President and District Councilor, Ed Flynn.
Thank you, Mayor Wu, and honored to be here. Want to say thank you to Congressman Lynch and Mayor Wu and my colleagues in the South Boston delegation. But what this day is about is coming together, supporting a health center that does so much critical work in support of our immigrant neighbors, residents in need, our seniors. residents living in public housing. This community health center is really the anchor, brings people together during difficult times. I want to say thank you to the wonderful, dedicated professional staff. They do a tremendous job. They're professional, they're compassionate, and we have a lot of respect for you. And on behalf of myself and Senator Collins and Rep. Beal and Michael Flaherty and Erin Murphy, we want to say thank you, Congressman Lynch and Michelle Wu, but we want to say thank you to the staff for everything you have done in support of our residents here in South Boston, especially our residents too in public housing developments. Thank you. At this time, I would like to acknowledge City Councilor Michael Flaherty.
Thank you, Eddie. I want to thank Congressman Lynch for doing the heavy lifting that he does every day, not just for this community, but for his entire district. Knows what it means to be a congressman. It's about helping people. And this here is a perfect example of very precious resources that will go to helping our community health center. And I say it all the time, here in Boston, we boast of the best hospitals and network of community health centers in the world, unmatched. We're blessed to have the South Boston Community Health Center and its leader, one of the best in that consortium of health centers, in his team that's here. And I want it known that as Boston's population has grown, South Boston has been a big driver of that, South Boston community as well as the South Boston waterfront, putting pressure and seeing demands on our local business district, our post office, our courthouse, and yes, our community health center. And Bill Halperin and the folks here at the South Boston Community Health Center absolutely crushed it during the pandemic. Hands down, arguably one of the busiest and proactive health centers of all of our health centers. And I speak as a citywide city councilor and not sort of having a specific horse in the race as an at-large member, but knowing the work. We spoke pretty regularly. I know that Ed and the mayor and others were working with Bill and the team here, making sure that they had the resources, the traffic details, all of it. But it wasn't just about servicing the folks that are right in the impacted area. They went further than that. They went through our public housing developments. They reached out. They partnered with the other community health centers that were struggling to get themselves off the ground and get back out on the front lines. And so to Bill Halperin and his team here, to know how blessed we are that you're here at this community health center, that you continue to lead other community health centers in that tremendous network. And as partners in government, always here to help you because you're helping our most vulnerable residents. This community health center, as suggested, is busting at the seams. This addition will go a great way to help sort of allow you to continue that great service and maybe even take on additional types of health services that currently don't exist in this community and for our more vulnerable residents. So with that, I'm so proud to be here, so proud to be aligned and to be considered a friend of our community health centers, and so proud to go to work with the folks that are up here that know what it means to help people and to make a difference, particularly with public health. And so with that, I'm going to introduce my at-large colleague, City Councilor Erin Murphy.
Thank you, everyone, for being here. Thank you, Bill and the team, and Margaret. She's a wonderful person. And I thank you, Mayor, but also to the South Boston delegation. I'm always proud when Congressman Lynch refers to me as their favorite cousin from Dorchester, but I love being here. But I'm also going to speak as a patient. I've been a patient at the South Boston Health Center for 15 years, myself and my children. And I know that you do offer so much: dental, eye care, the mental health, and this expansion is so necessary. And I can say firsthand during the pandemic, you also were offering such amazing need to myself personally, needing to meet with the doctor, and it was first, on Zoom, and that was hard to figure out, but you got us back in when you could, and my children were able to continue to access healthcare that's needed. And as a teacher, I know that one of the, if not the greatest equalizers, are quality schools in every neighborhood, but also access to healthcare is so important. And we saw during the pandemic that community health centers, or other people noticed what you already knew, that you were always providing what every neighborhood needs, and mostly, not mostly, but often our most vulnerable. So supporting this, and I do just want to remind and give a shout out to Council President Flynn. Last year when we had ARPA funds, he spearheaded, and all of his, you got all of us to support it, which was wonderful. But you were feeding your food pantry, which has always been a needed source here in the neighborhood. Got a lot of funding to increase the need there. So thank you for that. And just thank you for all you do, and just proud to be a strong partner at the city level. But I would love to introduce your state representative, David Beal, also. So David, thank you.
Thank you, Councilor, and it's an honor to be with everyone here today. Today is an important day for our community. My history with the Health Center goes back to when it was first built. My father worked on the building when it was built, and I remember coming here as a child to visit him on his lunch break, not going on the work site, but to see where it started and where it's come has just been astounding. As was mentioned earlier, we've seen tremendous population growth here in South Boston and the South Boston waterfront, and the Health Center has been taking care of this community for a very long time, and we've seen a necessary need to increase capacity. There's an expansion that happened previously down the South Boston waterfront, and with the expansion happening here, we'll continue to meet the need for the most vulnerable in our community. And I just want to echo the sentiments that were made earlier to Bill and the entire team here. Thank you so much for all that you've done to take care of us through some unprecedented times. We wouldn't be here without you, and thank you, and we appreciate you. Just proud to be a part of this team. It truly takes a village to get things done. At the federal level, want to thank Congressman Lynch for spearheading this effort to make this opportunity possible to meet the need for our community. To the mayor, our city councilors, thank you for being partners with us as well. And with my colleague Senator Collins, we're also proud and honored to be supporting the work being done here at the Health Center, whether it's behavioral health services or also securing funding to be a part of this addition. So look forward to the work ahead, and just thank you all for being here, and congratulations.
Thank you, David. I don't want to gainsay what David has talked about. The state funding for the Community Health Center has been amazing year after year in the budget. Senator Collins and David Beal have been tremendously responsive to the needs of the health center. And I do want to just amplify a little bit. We have another extension down the water. It's an urgent care clinic on the waterfront, also part of South Boston Community Health Center. And we have had so much growth on the waterfront, the South Boston waterfront and the Seaport area, that we're now seeing, but the Community Health Center did 70,000 appointments last year. And so that's not even counting what's going on down on the waterfront. And we understand that there's a steady volume of work, and we're seeing a lot of patients down there as well. So, and as several people have mentioned, the food pantry here. Unfortunately, that's a darker side of the pandemic, with people not working and people struggling. We have 3 major public housing developments of extremely low-income individuals, a lot of new immigrants to this country that haven't found their way yet to a point where they can sustain themselves, and they rely heavily on the food pantry here at South Boston Community Health Center. So it is heavily subscribed, and it's a real challenge, but it's wonderful to see as well the amount of giving that goes on here by the staff, by the community, by the docs, and nurses and staff. So we're grateful for them as well. I guess we're available for questions for any of us. If any of the press is interested, I see Beth over there.
I had some off-topic questions. I apologize.
That's okay. That's okay.
But I've been told I should address that afterwards.
Okay. Anybody on at least on this aspect of it? Okay. I guess we're good. Yeah. Thank you all for being here. Thank you for your wonderful work.